Again, I'm Dr. Thorpe Amize with Amize Health. I do these health educational videos. I put out one new video each week on this YouTube channel. And on the fourth Monday of every month at 8 p.m., I've been doing live Q&A sessions on the three topics. This week, we're talking about contraceptives, and the topics that we've talked about for the past 3 weeks were non-hormonal hormonal contraceptives, and then the long-acting contraceptives. So happy to have you guys join me today. So I'm going to do a quick run through of kind of the takeaway points that I went through during those videos, and then we'll kind of get into what questions everyone has. So for the non-hormonal contraceptives, the ones we talked about were condoms, diaphragms, the vaginal acidifying gel, spermicides, and then the withdrawal method. And the takeaway points from that was that basically most of the non-hormonal birth control options, their effectiveness, if you will, is based on the user. So that pretty much means if you don't put the condom on properly, then it won't be as effective. So it has to be applied appropriately. The diaphragm has to be inserted correctly. If you're withdrawing, you need to withdraw around the right time. So that's what it means by it's based on the user, because if you, as the person using that form of contraceptive option, if you do not do use it appropriately, then it's going to be less effective, which increases the chances of pregnancy. The hormonal options that we talked about were the patch, the shot, the ring, and then oral contraceptive pills, both the combined and then the progestin only contraceptive pill. And so for that, I made a point to say that hormonal birth control can affect your monthly bleeding. It can regulate your menses. So for some people who have irregular menstrual cycles, you can use it to kind of get that in control. And then for some people who have really painful menstrual cramps, things like that, it sometimes will help to decrease the pain. For some people, they do end up having some spotting though. And then know that the hormonal contraceptives do not protect against HIV. The only thing that protects against HIV, number one, obviously, is going to be abstinence. So if you're not engaging in sexual intercourse, and then using condoms to protect against HIV, the more, if they are more effective than the non-hormonal contraceptives, again, if used as directed, meaning, are you taking your oral contraceptive pills every day? Are you inserting the ring correctly? Are you taking the shot when you're supposed to and not missing doses? Are you applying the patch appropriately? So those are, again, the different reasons that it may or may not be more or less effective. And then the long-acting contraceptives are the IUDs, are the intrauterine devices, meaning they are inserted through the cervix into the uterus. The Nexplanon, which is or the implant, it's implanted in the upper portion of the arm, typically around that area. And then I put under long acting, which is more considered the more permanent contraceptive options, are vasectomy and then tubal ligation. So these are going to be the most effective birth control options. The copper IUD is the most effective of all of them, and then the other ones closely follow. And then all of these, for the long acting contraceptives, a physician or a clinician has to be the one to insert or remove or to do the procedure for a tubal or vasectomy. And then they can last for many years and impact your menstrual bleeding. The IUD or the Nexplanon, once removed, fertility is returned. And typically that's how that works. So That's kind of the gist of what I went through with each of the birth control options. And if for any of you that are joining me, we're talking about contraceptives. If you have any questions and you are watching, but you are not logged in on YouTube and unable to send your question via YouTube, then go ahead. If you have my number, send it to my number, or you can send it to one of the other social media platforms that I'm on Facebook or Instagram, and I will be checking as we're talking. And then for those of you who are logged into YouTube, you can go ahead and type any questions that you have directly into the box, and I'll be able to answer them. So once again, thank you guys for joining me. I'm going to give you guys some time to collect your thoughts if you haven't already, and send those questions over. And I'll get started with some of the questions that were already sent in to me. So far we have one question, which is, why does vaginal spermicide increase the risk of HIV? Now, that was something that I said in one of the videos, um, and didn't go into the explanation as to why. And it really isn't a long explanation. It's just that the chemical that's used in the spermicide can actually irritate the vagina and make it easier for STDs to enter the body. And so that's pretty much what it is. So typically with vaginal spermicide, we say it's not to be used by itself. If you're using spermicide, using it in conjunction with a condom is really the best way to go. And then the next question is, after a vasectomy or tubal ligation, where does the sperm or the eggs go when they're released? Which I think that's a great question. So typically with a vasectomy or tubal ligation, what happens is that the doctor is cutting off the blood supply to the tubes that carry the sperm out of the epididymis. So after the surgery, sperm gets reabsorbed into the body. Similarly, with a tubal ligation, when the fallopian tubes or the tubes are severed, eggs that are present actually get reabsorbed into the body. So it is not something that you have to become concerned about. The sperm does not come out during ejaculation, and the egg does not move on to get into the uterus to become, or is not able to get fertilized, because that connection is no longer there. So they tend to get reabsorbed into the body. Great question. So, for those of you that are on and participating, thank you so much for joining us. If you have any questions, go ahead and send them into the chat box, and I'll be sure to check them. And like I said, if for any reason you're not able to log in on YouTube in order to ask a question, you can absolutely send me a message on Facebook. You can send messages there, or you can send messages to me via Instagram, excuse me. So, any additional questions, I'm happy to answer. That's what I'm here for today, to keep the conversation going. So, I'm going to go ahead, and I have another question here, and it is, what happens if I don't wait between patches and active pills? Um, and basically take the next pill right away. I've read that people use this to skip their monthly cycle. That's absolutely the case. That people do use that to skip their monthly cycle, and it can be done that way. So, in essence, when you're taking oral contraceptive pills, you pretty much are, during the active pills is when you don't have menses, and then when you have that week of the inactive pills, that typically is when the menstrual will return. So if you skip those inactive pills and you just continue to the next pack, and continue the active pills, what's going to happen is that you don't get return of the cycle, and you know, you just won't have a menstrual until you get to inactive pills, or for any reason you miss pills, then you get a return of your menstrual. So a lot of people do that. You know, sometimes it's just the convenience thing. If you are going to go swim or you're going on vacation, and your menstrual is due to come up, that's one of the main reasons why people do that. And it is not something that's harmful. You absolutely, people do it, you can do it. um, and I hope that answers your question for you. So, again, any questions, you can go ahead and type them into the chat box, or be sure to go ahead and send me a message at Amize Health at on Facebook, or you can send me an inbox on Instagram at Amize Health, and same thing on Twitter at Amize Health. So I will check those to see if any of you that are not logged in on YouTube need to ask me a question and I'm not able to see it here. So happy to have you guys with me today as we continue a conversation that's surrounding contraceptives. I know that sometimes it can be daunting because, there really are a lot of contraceptive options out there in the market right now. And the key is picking what works best for you. Sometimes you start taking a contraceptive pill, for instance, and realize that you're having um, either side effects, you're having spotting that you don't want, you have increased acne, so many things can happen, nausea, and you just feel like this one just isn't working for me. So the answer to that isn't, I'm not going to take any form of oral contraceptive pill. The answer just may be, try a different one, because everything doesn't work with everyone's body chemistry in the same way. And so sometimes one brand of pill may work really well for one person, and then it just doesn't work as well for the next person. So that is a conversation that you really should have with your um, GYN provider or your primary care doctor in order to figure out what might work best for you. Now, if you decide, you know what, I don't even want to take pills because it's just too much. I have to remember to take a pill every single day. I don't feel like doing that. I don't want to set an alarm. There's other options out there. You can do the patch, you can do the ring. If you really don't want to have to think about anything at all, and you don't plan to get pregnant anytime soon, that's when the long acting contraceptives like the IUDs and like the arm implant would work best for someone like you. If you're like, I'm not having any kids anytime soon and I'm not trying to take these pills, those options are really good for you. So, I mean, there are so many different options. Like I said, a conversation with your GYN provider or your primary care provider is really what's going to be best for you. So, one question that just popped up is, why can't you breastfeed when using um, estrogen based contraceptives? So, estrogen is so when we do oral contraceptives, we do not, there are none that are primarily just estrogen based. It's either combined estrogen progesterone or it's progesterone only. And estrogen, if you're taking it in the 3 weeks postpartum, so meaning 3 weeks after having the baby, and you start taking an estrogen containing oral contraceptive pill or any of the other contraceptive options containing estrogen, the problem with that is it increases the risk for what we call thromboembolisms or clots in postpartum women. So some women end up having what we call DVTs, or deep vein thromboses, so clots in the legs and the deep veins of the legs, or pulmonary embolisms, which are clots in the lungs, and those can really be life threatening. So we tend to not prescribe estrogen containing oral contraceptive pills or estrogen containing contraceptives right directly postpartum because of that increased risk. So it's really just for the protection of mom after having baby. So we would usually use one of the progesterone only containing pills, like the mini pill, or we recommend progesterone only, like other contraceptive options such as like the IUD, the Nexplanon. Those are all only only progesterone based. Also, Depo is another one, but nothing with estrogen in it. So yeah, that's why. And I hope that answered your question. Any other questions for anyone that's joining us? For all of you that are new or just joined, this week we are having a discussion about contraceptives as a whole, non-hormonal, hormonal, the long-acting. If you have any questions regarding any of those, please go ahead and type it into the box. If you are not logged into YouTube and you have a question, send it to me as a message on Facebook at Amize Health, or a message on Instagram at Amize Health. Same thing on Twitter. I'll just continue to check them to make sure that I don't have questions popping up from you guys. So I want to make sure I get your questions answered today. So bear with me. I'm going to make sure I keep an eye on those things. But if you are joining me and you have a question and you're able to go ahead and type it in the box, that would be great. So I'm going to continue going. We've been getting a lot of great questions thus far. Some on right here on YouTube and some otherwise. So I'm going to continue with the questions that I've received as you all that are on. If you don't have a question right now, if you think up any questions, go ahead and feel free to ask. I'm happy to answer. So we answered the questions about continuing to take your active patches, or your active pills, and skipping the inactive week, or continuing the patches. It's the same thing if you're trying to avoid getting a menstrual. So another question is, oh, I mentioned that the right timing for the withdrawal method. Could I recommend the right timing? So the withdrawal method is actually probably one of the least effective methods. So 21% of people who use the withdrawal method will still end up pregnant. And the reason for that is because, so the way the withdrawal method works is that the male has to withdraw prior to ejaculation. So sometimes what happens is, in the pre-ejaculate, which is basically what comes out of the penis prior to ejaculation, in the pre-ejaculate, sometimes there are sperm there. And so that can lead to pregnancy. And so even though basically withdrawing prior to ejaculation is really the key, some of that pre-ejaculate can still lead to pregnancy. And so that's why sometimes that doesn't work as well as people would like it to. It requires the male to really know and have some control, some self-control, in order for that to also work. Some people really like that method because of the fact that it's natural. They don't feel like they're using anything. They don't want to use anything. And it's absolutely something that you can do. It's just that because of the pre-ejaculate, the percentage of women that get pregnant on that method is actually it's higher than the other methods. Okay, I hope I was able to answer that question for you. Any additional questions, like I said, type them into the chat box or send me a message on one of these platforms. And I'm going to continue talking about the contraceptive options. So one of the things that I did want to bring up myself was about, I did not mention, was about the fact that the copper IUD actually can be used as a form of emergency contraception. Um, and it can be implanted up to 7 days after having unprotected sex or sex where you are concerned that you might get pregnant. Maybe the condom broke or for whatever reason. So that's actually one of the options that you can use as a form of emergency contraception. Any additional questions for me? So let me see what other questions I have here. For you guys that's on YouTube, signed in on YouTube, go ahead and type them into the chat box. Otherwise, I don't, it doesn't look like I have any more questions. Let me see here. Oh, how effective are condoms in protecting against HIV? So, aside from abstinence, condoms are pretty much your gold standard. At using condoms is what you need in order to protect against HIV, because the other forms of birth control that I have discussed, the hormonal birth control, the long acting, the implant, the IUDs, all of they do not protect against HIV. You require a barrier method, such as a condom, in order to protect against HIV, and that needs to be used appropriately. One other thing that comes up, especially with my young people, is, you know, oh, I'm they'll be afraid. Someone will say, "Oh, I'm afraid of getting HIV, or I'm afraid of getting an STD. I'm going to put on multiple condoms." So I would recommend against doing that. The friction, when you when you place a condom on and then you add additional condoms on top of it, the friction of those, whether it be latex or lambskin or the polyurethane, whatever the material is, the friction between those material will actually cause the condom to break. And so that's not what you want. So you want to use one condom and apply that condom effectively. Okay, so no double and triple condoms. That's not what you want to do. You want to apply a condom appropriately and effectively. Okay. Any additional questions for me, go ahead and type them into the chat box. I'm so happy to have you guys on here today, because this is such an important conversation about contraceptives. I don't think, just based on my experience with patients in the office, a lot of times, a lot of us don't know what our options are, or don't know what all the options are out there, or even if we hear about them, sometimes we don't get all the information in order to make an educated decision. And what I want all of you to be able to do is make educated, informed decisions when you're making choices for your body and for your health. You want to know what your options are, understand what your options are in order to select what is the right thing for you. What works for your friend may not work for you. Because and I get that a lot, especially when it comes to like the IUDs and Nexplanon, is that people will be like, well, my friend has the Mirena and the Mirena did this to her, and so I don't want the Mirena, or I don't want an IUD at all because this happened to my friend. And let me tell you, we can't predict what's going to happen when you use the IUD. However, how it happened with your friend may not be how it happens for you. Um, the course of how we expect things to go is based off of what happens to most people. So, what happens with your friend's IUD doesn't have anything to do with your IUD or your cervix. So, the decision of what to do for yourself is yours and yours alone. And I encourage you, if you are considering it, or you just want more information, or you don't understand, or you have questions, talk to your doctor, talk to your primary care doctor, or talk to your GYN doctor. They may be one and the same. Okay. And I think that will help in the decision making process quite a bit. You can schedule an appointment specifically just for that. I'm sure they will be happy to talk to you about it. Okay. Any additional questions, go ahead and type them in the box. I'm going to just do my social media check again. If anyone has any questions and they want to post them online or message me, I'm happy to answer them. If you happen to know me personally and have my phone, you can also text me a question if you have a question that way. Okay. So I will say, I'm going to keep going because I will say, so the copper IUD, I mentioned this before, the copper IUD is the most effective form of emergency contraception. But the Mirena is basically very close behind with similar effectiveness. And then we have Ella, which is a pill. And then we have Plan B, which is a pill also. Plan B has the 1-step or 2-step. And Plan B, basically, we typically, sorry, I was seeing getting a message there. So we typically would recommend that if you if your body mass index is more than 30, so your BMI is more than 30, then we don't recommend using Plan B. Plan B is over the counter. And so most people will be like, oh, I'll just go take Plan B. I don't need to get a prescription. But it's not as effective for those over 30 with their BMI. In that case, we actually would recommend using Ella or the Ulipristal instead. So I would just keep that in mind. There's another method which I mess this name up all the time, but it's USP, which is basically using the combined hormonal contraceptive, the oral. So one that has estrogen in it. It's less effective than taking Ella or Plan B, but it is an option, and it does have a higher risk of nausea, vomiting. um, but you basically would take the pill, you would take that 12 hours apart. And that's actually one of the methods that you can use as a form of emergency contraception, excuse me. And then the other thing to mention is combined hormonal contraceptives typically aren't prescribed to people who have migraines with aura. So if you are someone that have migraines with aura, and what do I mean by aura? So an aura, when you have a migraine, is something that precedes the migraine. So it comes before. So for instance, if you are someone that suffers from migraine, you probably already know what I mean, but sometimes you can get a certain smell that you notice, like a sensitivity, a certain smell, or you get sensitive to lights, or you get flashing lights or floaters that move across your vision. There are different things that can happen. The more common ones tends to be like people seeing flashing lights or things like that, but something that precedes or comes before the migraine. If you have migraines with aura, then we avoid using the combined hormonal contraceptives for those people because of the estrogen, which increases the risk of ischemic stroke, which it basically is just saying it increases the risk of stroke. So if you are someone who has that history, you want to make sure that's something that you tell your doctor so that they know. Likely they'll ask, but I want you to know so that you're informed. And when you go in that office, you know what you should be telling your doctor. Don't hold anything back, because holding information back, especially information like that, when you already have um, a medical condition, no matter how big or small, you really need to tell your doctor, because those things can impact the treatments that we prescribe. And so it's really important for us, for you as a patient, to just be honest with your doctor and tell us what's going on. Okay. So it looks like we have Um, another, I'm sorry. Sorry, I just got a little bit derailed. So let me just finish this up and then I'll get back to that. Then the next question. So the other thing that as I go through this that I wanted to mention is the length of time that you can use certain contraceptives. And some one of the things that patients typically ask about is it really safe for me to take to have the IUD in my body for so long? Is it really safe? So the copper IUD can be implanted for up to 12 years. The Mirena IUD, which is a hormonal form of the IUD, can be implanted for up to 8 years. And then the next one on the implant, the subdermal implant, can be implanted for up to 5 years. Those are long periods of time, but there are studies that show that these methods are effective for that length of time. And so that is why we recommend that they can be left in for that long. So I definitely do recommend that you consider it again if you just feel like you're not interested in having kids anytime soon. You're a young person, it could, 18-year-old, 20-year-old, and you're like, look, I'm just not ready for kids. That is absolutely an option. If you are someone that says, okay, I've had kids, I don't want any more, I want to stop, I'm just done. But you don't want to do a more permanent form of contraception, or you just don't want to use any of the other methods, consider it, because you can leave them in for a long period of time. And I think that this is a really good option for many individuals. Any questions about that before we proceed? Any additional questions from anyone? So there's so much to talk about, and I just want to make sure that I'm answering the questions that you all want me to answer. So if there are any additional questions, be sure to go ahead and send me a message, either on the either on the YouTube chat or send me a message on one of the social media platforms. So I'm just going to go ahead and check again. I'm just going to say again, it's a pleasure having you all here. I'm so happy that you guys joined. I'm so glad that you all have these wonderful questions that you've been asking thus far. And I'm going to go ahead and continue to answer any questions that you guys have. If there is anything that I can answer for you, be sure to type it in the chat or send me a message to one of the social media platforms at Amize Health on YouTube, Facebook, Instagram, or Twitter. Okay. So what other things do you all want to talk about? We still have some time here, so get your questions in. I'm just going ahead and check in to see if I had any questions from anyone else that I might have missed. Okay. So I'll just go ahead and talk about I'm glad that that answered your question. I'm going to go ahead and talk about some of the things that people commonly bring up at their appointments. So if you are interested in basically one of the birth control options that has to be prescribed, so any of the hormonal options or the long acting. So typically There are quick start methods for like oral contraceptive pills, for instance. And what I mean by quick start method is um, previously we used to recommend just starting the first day of your menstrual, which you still can do, but there are quick start methods. So if you want to do that, there's a breakdown for different quick start methods. And one of the websites that I typically recommend for use is the reproductive health website, which is RHAP, and then it's RHAP contraception. So it's reproductiveaccess.org. They have so much information about contraception there, and they keep it updated, which is great. They keep it updated so as things change, and as, for instance, the length of time for recommendation for the IUDs and next one on change, they keep those things updated. So that's a great resource if you're looking for information. Um, when you come in and if you are interested in one of those, one of the long acting options, then we typically do want to have a negative pregnancy test. So that is something that we'll ask you to do, is give some urine, make sure we do a negative pregnancy test. We do go over, in that appointment, we'll go over the specifics that's needed, or the specifics about the particular type of contraception that you are selecting. And then we also, for the procedures, for, like I said, all the long acting options, they are considered procedures. And so you need to consent to have that procedure done. And so usually there is a visit before that form of contraception is placed, before an IUD or Nexplanon is placed. There are a few places that will do it same day, especially if you are trying to use the, like, let's say you're trying to use the copper IUD as a form of emergency contraception, then a lot of places will go ahead and just place it the same day. Um, but overall, at least since I've been here in the South, a lot of times you need to get an appointment first, go through the kind of counseling regarding getting that particular method, or talking about what your the various options are before then you go back in and get the procedure done on another day. Okay. Um people So one of the ones I haven't spoken about a lot is Depo. Depo is the shot that you can get pretty much every 13 weeks. Um, it has, it's one of the things that is recommended, that it can be given, you can give it to yourself safely because it's a subcutaneous injection, which basically it's similar to people who give themselves insulin. You're just injecting right into the fat underneath, right underneath the skin. So, and that's every 13 weeks. Most places will have you do it at the office, or if you don't feel comfortable doing it yourself, you do it at the office. You typically will have, recurring appointments for every 3 months, in order to get it done. If you miss, for instance, you don't go in when you're supposed to, then you gonna have to get another pregnancy test to ensure that everything is okay before, or ensure that you're not pregnant before they move forward with giving you the next shot. That's typically what happens. With Depo, there was a lot of attention to Depo Provera because of the decrease in bone density that's associated with the use of Depo. But it is, once you stop taking Depo, it's reversible. So because of that, the College of Obstetrics and Gynecology still recommend women use Depo as their form of birth control if that's preferred. So it is a great option. There are a lot of women that the most common thing that I've gotten that people complain about is weight gain. And it's real. It's a real thing. You can potentially gain some weight on it, but you can gain weight on some of the other contraceptives also. But that seems to be one of the ones that people complain about the most with when it comes to weight gain. And so with that, I would say, if you take it and you notice that you're gaining weight, again, there's so many other options that you can choose from. So it just may not be the best option for you. And so just take that into consideration. Don't look at, Susie or Mary or Jane's reaction to any form of contraception to make your decision. You really need to make your decision for yourself. Okay? Ask your doctor questions. I cannot stress that enough. That's like a big thing with me. If you haven't noticed that I say that a lot, I think I say that in every video. Make sure you ask questions. Sometimes we get really shy, or maybe even embarrassed sometimes to ask our doctor questions. I know even as a physician, it's absolutely happened to me that I felt like, oh, walked out of somewhere and I'm like, I should have asked this or I should have asked that. And, one of the things that I am learning to do is to advocate for myself. And again, I say that even as a physician, I have to advocate for myself. So I really encourage you all to do that. So I'm not telling you to do something that I wouldn't do. I absolutely think we all need to advocate for ourselves, ask questions. It may sound like something that is a dumb question in your head, because sometimes that's why I don't ask. Like, I'm like, oh, they probably expect that I'm already going to know this. But when it comes to yourself, or when it comes to someone very close to you, if things get blurry, when I go to the doctor, I want to be the patient. I don't want to be my own doctor. So I ask questions, and it really helps to clarify things. And sometimes, you get pushback because people, the doctor don't have enough time, which is why we do these chats. Sometimes the doctor doesn't have enough time, or sometimes they're just not able to answer your question at the time. But I really do encourage you to ask those questions, because that helps to give you understanding of what is happening. And at the end of the day, this is your health, and you need to advocate for your health. You need to know what's going on in your body, and whatever drug, whatever medication is prescribed, how it's going to impact you. So advocate for yourself and ask those questions. Okay? Any additional questions from anyone, both on social media or that's currently signed in on YouTube? I am happy to take your questions. So go ahead and let me know if you have any. Okay. So I'm so glad that you all were able to join me today. Um, you know, I think that what we do here is really important, and I really want you all to feel empowered and educated. If you have any topics that you want me to talk about, please pop it into the chat box, or send me a message via one of the social media platforms. I'm happy to kind of review if it is within the scope of my practice. Let me say that again. If it is within the scope of my practice, I will absolutely go ahead and do some videos on it, so we can have a Q&A. And I think that that would be most helpful for you all, is if it's something that you tell me, okay, Dr. Thorpe or Dr. Thorpe and Mize, this is something that I want to talk about. Can you talk about it? I'll be happy to, as long as it's within the scope of my practice, because I don't speak on things that's outside of the scope. Okay. All right. Any additional questions from any of you? Again, so happy to have you guys come on and spend some time getting some information. I hope I've been able to answer all your questions. I don't think there is anything else that I had that I wanted to bring up. So I will say, let me see here, because I had things ready. There were a couple of things that I did not speak on that were non-hormonal contraceptive options, and I didn't really mention them when I did the videos, and I guess I can go over a couple of them right now, which is, I don't think I spoke about cervical caps. And cervical caps are basically, it's just a reusable silicone device that's inserted into the vagina. In essence, it creates a suction over the cervix, um, that is pretty much like a barrier, a physical barrier to sperm. So in essence, it's preventing the sperm from getting into the cervix and then finding their way to the eggs. So it's usually prescribed and fitted by your doctor, to make sure that it's the right size for your cervix. And then after you get it fitted, kind of like the fitted diaphragm, after you get it fitted, you can insert it and remove it whenever you want to have sex to make sure. But you have to make sure you get it replaced and refitted every couple years or so. Um, you know, with cervical caps, they're more effective in people who haven't given birth, and likely that's related to the size of the cervix, because after you've given birth, um the cervix size will change. But again, with a cervical cap, you're going to get fitted anyway. But that's just something I wanted to tell you guys. And then, just like the other ones, it's not a condom. It does not protect against STIs. So I would just keep that in mind. If you once you've had intercourse, you leave it in for at least 6 hours, and then you remove it within 48 hours after you've inserted it. So it's not something that you should like let stay there. Take it out. Don't let 48 hours pass and you haven't removed it. And the only reason for that is because you don't want to increase risk of infection. So that's the same, like, so the other one that I didn't talk about was the contraceptive sponge. So the sponge is like a foam, a piece of, it's like plastic piece of foam that has spermicide in it. You insert it into the vagina before intercourse, and then what you have to do is wet the sponge a bit and then place it into your vagina up to 24 hours, up to 24 hours prior to having sex. So it does a similar thing, which is basically acting as a barrier between the sperm and the cervix. Um, and it's a little bit more effective than the cervical caps. The thing that you need to know is that you need to remove them at least 6 hours after intercourse. So the last one, the cervical cap, you leave in for 6 hours after intercourse. This one, you remove it in 6 hours after intercourse. Um, but you really shouldn't have it in the vagina any longer than, it says, I think it's up to 30 hours. And then they pretty much have the same kind of side effect profile as spermicide. So like you can get some irritation, and some people will have some reaction to it. Uh, but it's another non-hormonal contraceptive option to consider. Like I said, there are so many options out there, and I just want to make sure that you all are aware and are choosing what is going to work best for you. So we're down to the last kind of few minutes for this session on contraceptives. If you all have any additional questions, this would be the time to send them in. I'm glad that you guys joined me today. I think it was a good discussion. I think one I did try to answer every question that was sent in. I think I did get to everything. If I didn't, I apologize. But feel free to send in any questions that you have at this time, and send it to me via this chat box or via any of the social media streaming. Now, for this coming month, I haven't decided what topics to do yet. So I really do want to hear from you guys. Um, what topics you guys want to hear about? What do you think would be beneficial for you? Is there some questions that you wanted to ask your doctor, but you just never did? For what one reason or another. There is no reason for us to be embarrassed. You can see I am not embarrassed about talking about these things because this is what I do. This is what I talk to patients about. And I'm happy to talk to you guys about them too, because again, I want you to be informed. So if you have any questions, if you feel like, you don't want to type it in the box, or you have a topic you want to hear about, please feel free to either shoot me a message if you or text if you have my contact directly. If you don't, reach out to me via one of the social media platforms. You can send me a private message. It does not have to be public for everyone to see, and I will go ahead and see if next month we'll do that topic. If not, I'll figure out something. But basically, we'll be doing a new video on the Monday, every Monday for the first 3 Mondays of the month, and then the last Monday, the fourth Monday, excuse me, the fourth Monday, which usually is the last Monday, but the fourth Monday at 8 p.m. we have these Q&A sessions, and usually about those topics. And I encourage you, go, look at the videos, because it helps you to know what I talked about. So, and it helps you to frame your questions. But even if you didn't watch the videos, guess what? I'm going to answer your questions anyway. So come back 4 weeks. We doing this again. Okay. Fourth Monday of each month at 8 p.m. And we'll be chatting again then. All right, so I'm going to take a look one more time if anyone has any questions before we hop off. It was lovely chatting with all of you about contraceptive options. Again, I say it is such an important topic. And I definitely didn't cover everything because there is so much to cover about each one, because there are uses for a lot of these that are not just to prevent pregnancy. And I didn't go into all of that. But maybe another time, if that's a topic you want to hear about, let me know. So there are definitely a lot of uses for a lot of these contraceptives that we didn't talk about. I didn't go into a lot because it really is a lot, and that's why I have these Q&As, because I want to know what you all want to know about. So again, send me a message. Let me know if there are things that you want to topics you want to hear about as we move forward. You'll see the next video posted on Mondays, and then fourth Mondays, 8 p.m. I'm back here again. So we'll be chatting again. I'm so glad you all joined me. I'm so glad you all joined me. You guys have a wonderful week. It was so nice having you all on. Feel free to message me at any time if you have any questions. I definitely will be happy to answer your questions. And I might save them for the next conversation, just so you're aware. Okay? You guys have a wonderful night. We'll talk again soon.